Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with us is Dr. Kevin Miller today. He is a palliative care physician at Thunder Bay Regional Health Science Center, and today we are going to talk about advanced healthcare planning. Imagine a situation in which you are admitted to the intensive care unit of the hospital, either because of a motor vehicle accident or sudden deterioration in your health, and you are not able to communicate or convey your decisions about management of your health care. In such situation, your family members are faced with a very difficult task of taking your healthcare decisions on your behalf without knowing your choices. And in all such cases, advanced healthcare planning helps a lot to everyone. And Dr. Kevin Miller is going to guide us about process of advanced healthcare planning and how important it is for all of us. Thank you, Dr. Miller, to coming to the show.
Thank you, Prashant.
Please tell us about what is advanced healthcare planning and why it is so much important.
Well, I think as you outlined in your introduction, we can often be faced with situations where we're not able to speak our own wishes. And as you said, the challenge and burden that this can form on our families or our loved ones to try and make decisions in such an already stressful situation where there's been a motor vehicle collision or whether there's been some sort of very devastating health event. Advanced directives allow us to communicate what our wishes and provide guidance to our loved ones about what we would want in the event of such a condition change.
So is it like a sort of a paper or a document, or how do we prepare this advanced healthcare directive?
It's a challenging topic to describe because, in fact, many jurisdictions have different laws about what is effective. In the United States, they often talk about something called a living will. In Ontario, an advanced directive is that document. In some provinces, this document is legally binding, whereby doctors and your family must adhere to the instructions that you leave them. In Ontario, it is not binding. So although there could be a paper copy or instructions, what's far more important is that we talk to our loved ones about the decisions we'd want. And this is a difficult discussion to have at the best of times. But I think if we utilize some of the tools available out there, for all of us, whether you're healthy or whether you're facing some sort of illness, any illness or disease could lead to a deterioration. Heart disease, kidney disease, lung disease, cancer, neuromuscular disease. Any of these illnesses might cause a change in our health such that we can't tell people what we want. And it's very important that we talk to our loved ones so that they know what we would want in case we can't say it ourselves.
So verbal communication is also important if you don't have a written or legalized document.
In Ontario, because there isn't a legal document, most important is that our family members, or in Ontario, in fact, there is always someone who would speak on your behalf. Mm-hmm. In your example, if someone were to be in a motor vehicle collision and was taken to the ICU, first off, the doctors, our teams, would ask that person. But if that person could not express themselves,
yes,
then the law in Ontario tells us as doctors and healthcare professionals who we must communicate with regarding decisions about what to do or what not to do.
Mm-hmm. So at what point one should start planning this advanced healthcare?
I think these are things that in general we're afraid to talk about. I would suggest that we should all have these discussions at all times, whether you're a 30-year-old, a 20-year-old, a 50-year-old, an 80-year-old, or if you've made it to the lovely age of 100. It's important that we all are having these conversations with the people around us and the people who care for us so that they know. We hope never to use it. Mm-hmm. I tell people it's like an insurance policy. You don't want your house to burn down, but sure good to have it in policy.
It's good to talk to your family ahead of time, as soon as possible, probably.
Exactly.
What is the difference between advanced healthcare plan and advanced healthcare directive?
In Ontario, there really is just different terminology.
Okay.
But I think that sometimes where people get confused is looking at an advanced care directive or an advanced healthcare plan as instructions. Mm-hmm. what happens if we think about it as instructions? If I were to tell you, for example, that if I had a stroke, I wouldn't want you to put me on life support and keep me alive. And people often say, I wouldn't want to be kept in a vegetative state. I think what's more important than the specifics of the directive, which talks about specific healthcare problems, the problem is none of us has a crystal ball to know what healthcare problems are going to befall us.
Yes.
So I think it's more important that we talk not so much about what to do if I have a heart attack or if I have a stroke or if I have cancer, but rather to let our loved ones know what health quality is important to us.
Yes.
You know, many people like to get out in the outdoors and hunting and fishing. And I've had many patients who tell me, you know, as long as I can do those things, then that's good quality of life for me. My grandmother, when I was in medical school actually, had horrible lung disease. And although she struggled with the breathing, she was in hospital, her directive really was that as long as she could play bridge, then we would do whatever treatments that would permit her to continue to sit at the bridge table. And this made it much easier for my father's family to be able to communicate about what treatments to give her, because if those treatments wouldn't help her to continue playing bridge, then it's not something she would want.
Okay. Is there any form or a document, a government form available, any website or anywhere where one can fill those advance directive and give it to loved ones or legalize a document?
So in Ontario, there's many different resources. The Ministry of Health in Ontario has a document which helps to explain some of what these things are. In addition, the Canadian Hospice and Palliative Care Association, the CHPCA, has a website. And the campaign they have is called Speak Up. And it's available for all the provinces, but there is a specific workbook which is available in Ontario. You can download it, you can work on it online, but it really asks some of these questions about what's important to someone. This workbook would give an opportunity for you to document those values that you have and share that, but also discuss it, as I said, with your family and loved ones.
Now, who decides that you are not able to make a decision or you are not able to take care of your healthcare decisions when you meet with a accident or sudden deterioration in the health?
So it can be complicated, but I think there's times when it's very clear. You know, someone is unconscious and not able to speak, someone else must make a decision on their behalf. And other times, like talking to you today, Prashant, you know, you're pretty clear. There's not a question that you can make your own decisions. But when it comes to decisions in healthcare, what is most important is that patients understand what's being proposed, but also the consequences of either having a treatment or not having a treatment, taking a drug or not taking a drug, having a surgery or not having a surgery. And so it's important as healthcare providers, we are responsible every time we propose a decision to understand whether someone is capable of making that decision.
So it's the healthcare provider who decides?
It is inherent on the healthcare provider to decide if someone is capable. They may use the information. Oftentimes family will express concerns that their loved ones may be confused. But I think sometimes it depends on the decision. You know, for example, you know, if I asked you if you wanted a tomato sandwich and you know, and onions, you might say, I don't like onions. And that's a pretty easy decision. And I say, well, why don't you want it? You say, well, it gives me heartburn. That's a pretty easy decision. But if I'm proposing something very complicated, you know, for example, maybe a surgery to remove a tumor, or complicated surgery to repair injuries from a motor vehicle collision, or other healthcare things, the implications of these decisions is far greater than, you know, a little bit of heartburn, perhaps.
Yes, yes. Thank you, Dr. Miller. We'll take a short break and we'll continue the discussion after that.
Sure.
Please stay back for the next part. Thank you. Welcome back to the show, Talk with Your Doc. Today we are with Dr. Kevin Miller and he is guiding us about how to prepare advanced healthcare planning. Thank you, Dr. Miller. We were talking about who takes the decision, and you mentioned that a physician decides whether the patient is capable of making their own decisions. If not, then their family members gets the chance to make a decision. Now suppose somebody has not given any advanced healthcare information to their family members and they are unconscious, they are not able to take the decisions. What happens in that case?
So in Ontario, we're fortunate that there is actually a law that tells a doctor or a healthcare provider who they must ask those questions of. We call it a hierarchy because it kind of goes from top, first, second, third, down through a list. The list is easily found on the website, but essentially there can be someone who's legally designated. So if, for example, you decide that you want your best friend to be your substitute decision maker, the person to speak on your behalf, then you would actually sign a document called a power of attorney for personal care. And this document gives that person permission, legal permission, to speak on your behalf.
So it's called a substitute decision maker. So that you can decide ahead of time with the power of attorney document?
Yeah.
It's a legal document.
It's a legal document. It's quite easy to prepare. But the problem is that many people don't know about it. You do not need a lawyer to complete it. And in fact, it can be witnessed by a notary public. And many hospitals in Ontario actually will help people do this and can sign it off and guide people through the process. If someone doesn't have a power of attorney, however, then the Act still tells us who we must speak to. It might be that there is a court-appointed guardian, but if there is not a guardian or a power of attorney, then it comes to family. First off, it might be a spouse, or it might be the adult children of an older adult, or it might be a parent if the person is younger, or a grandparent, or it could relate to a more distant relative. And it's interesting, it's not, as we might sometimes have in our families, the oldest child is the person who makes the decision. When it comes to the Substitute Decision Makers Act of Ontario, it's actually all of the children who make a decision. And they must all be in agreement with the decisions. If you've got kids who all agree with each other, and some of us have that, then that can work well. But sometimes there's disagreements with families.
Yes.
And so it's important then that if there could be some discrepancy, or perhaps if some of your family members might agree or not agree with you, then that's where, again, designating a power of attorney legally will give that person the ability to make the decisions.
So substitute decision maker, if you haven't appointed, then who decides this? Doctor decides, or the law decides, or who decides this?
The law actually tells us who we must choose. So we must first go through this hierarchy and down the list.
So it's the doctor who is guided by the law?
Correct. Unfortunately, sometimes we'll come across a situation where there isn't anyone we can find. And in that situation, the last resort is used. And in Ontario, the Office of the Public Guardian and Trustee, which makes decisions, and there's a group of people there. And all of these decisions are generally approached with what's in the patient's best interest. But of course, if you don't have the document and you haven't expressed that, and there's no one who can speak on your behalf, then it's up to the doctors and the healthcare team to try and guess what's in your best interest. And I don't think any of us want that.
Now you mentioned that public notarized document can help. Now, has it to be witnessed, or if so, who should be the witness of these documents?
So in the situation of a power of attorney document, it can be witnessed by anyone who's not directly involved in your care. Okay. So sometimes in my practice, when I see patients in the hospital, maybe a nurse or a manager from the unit might be able to witness that in conjunction with the patient and family.
Now, if somebody prepares, say, advanced healthcare directive or advanced healthcare plan or notarized document, where this document should be kept?
A great question.
Because sometimes you can't find it.
Well, and it reminds me of a recent case where some of these discussions had happened with the patient and their power of attorneys, but unfortunately, in the middle of a crisis, oftentimes we don't know. Mm-hmm. So in Thunder Bay, at least, many of the paramedics and the emergency personnel know to look for these documents on the fridge. So many times putting it into a colored envelope and put it on a magnet on the fridge or on top of the fridge, this can permit us to know where to look for it.
Which is visible to everybody.
Visible, easy to find, accessible. However, if those documents are not found, then of course you want the people that you love to know where they can be found. So sometimes that could be, at home in a special drawer or otherwise. But again, your substitute decision makers, your family, the people who care for you need to know how to find that document.
Now, suppose there is an emergency situation, somebody is admitted to the hospital and there is no family members around, and the doctor who is treating doesn't know what is the advanced care directive of this. What happens in that situation?
Well, in general, doctors and nurses and healthcare professionals will try to act in the best interest of the patient. So what that means is that, if there's a reasonable chance of helping someone recover to good quality of life, then even without consent, the Act permits physicians and healthcare professionals to act in the best interest of a patient in emergency situations. And so sometimes what happens is that in my previous work, I worked in the emergency department in Nipigon. And so sometimes what would happen is if there was a car accident or otherwise, someone would arrive in our emergency department, but their family would be driving or flying from somewhere else, and we weren't able to reach them. So it's inherent on healthcare providers to act in the best interest of the patient until we can speak to a loved one to know what those wishes are.
Now, so once somebody signs an advanced healthcare directive or healthcare plan, how long is it valid?
Another good question. In Ontario, these documents don't expire. However, it's important, as I said, that the communication and the discussion is continuous. Because over the course of months and years, sometimes your decisions might change.
Correct.
In Ontario, because the document is not legally binding, the document really forms an opportunity for discussion. If we look back and, for example, said, well, here's one that someone had from 2009, the discussion that the physicians or healthcare team might have with the loved one when the patient's not able to have that discussion themselves might say, well, that was 2009. Are these still the person's wishes? And again, if you've had your discussions with your family, then they may be able to say, yeah, no, this is what he or she still believed in. Or they might be able to say, well, they agreed with this, but they had some different ideas about this. So again, because it's not legally binding, it's the jumping off point, a place to start to have those discussions.
Now, are there any situations where somebody has given an advanced healthcare directive and the doctor may not follow it because of a health-related situation?
Again, a recent situation where I was called to attend to a patient who ended up in the emergency department and had a lot of active and aggressive treatments that this person didn't want. And part of the problem, again, is communication. If the healthcare providers have not got that information, then they will generally act and behave in a way more aggressive, with more interventions and more treatments. So all the more reason to have these discussions and make sure that people know about what your wishes are, because we're more likely to do things that people probably don't want than to hold back. Most of the time we end up doing too much rather than too little, if we don't know.
Thank you, Dr. Miller. The discussion is very interesting. We'll continue after a short break.
Sure.
Thank you. Please stay back for the last part. Welcome back to the show, Talk with Your Doc. Today we are talking a very interesting topic on Advanced Healthcare Directive, and Dr. Miller is helping us to understand this complicated subject. So Dr. Miller, if somebody has a wish not to resuscitate them or do not give CPR, and if somebody does the CPR while they are unconscious, what happens in that case?
Well, you raise an interesting concern. Obviously, if we've gone through the effort of having an advance directive and explaining to our loved ones what we want, and if those directives are available and clearly understood by the healthcare team, if someone contradicts those wishes or the expressed directives of your substitute decision maker or power of attorney, then essentially a healthcare worker would essentially be assaulting you by doing something that you don't want. And I guess there'd be potential legal consequences.
But the healthcare worker doesn't know that you have this no CPR or do not resuscitate form.
Well, I think that that's the challenge.
What is
that
the form? What is the do not resuscitate form, and where one should keep this so that everybody knows about it?
So up until now, we've been talking about the Substitute Decision Makers Act and about advanced care directives. There is in Ontario a very specific form which permits the ambulance and firefighters, emergency personnel, not to perform CPR or resuscitation. Very important to clarify, that doesn't mean that they won't help you. If you've fallen, if you've injured your leg, if you are in pain, or if you need some oxygen, they'll do those things. But the no CPR form is a specific form which tells the ambulance attendants and the firefighters that you do not wish to have resuscitation. This specifically is about after you've died.
Okay.
If you've died, your heart has stopped, you're not breathing, this gives them permission not to intervene. But of course, like all of these things we've talked about, it's only useful if people know that they have it. So also, like the other documents, having it on the fridge, many of my patients will tape it on their door, right inside the front of their...
or it would be nice to keep it in a pocket, probably.
I often tell people, put it in your purse, put it in your wallet, put it in your car, give it to your family members. And the document in Ontario, while legally binding, a copy is equally legally binding. So we often try and get 5, 10 copies, give them to everyone who's important to you.
So is there any specific no CPR form available?
Yeah, so in Ontario it's called a do not resuscitate validity form.
Okay.
The form, perhaps we can show a picture of it for our viewers. The form is available from healthcare providers and from the hospital. It needs to be completed by either a doctor or a nurse practitioner. And again, like everything we've talked about, it's most important that the people who are potentially making decisions for you and your loved ones, your family, know that this document exists. Because, it's all well and good to have it done and left in a drawer somewhere, but it won't do you any good if people can't find it or don't know about it.
Now, is it important to mention about the organ donation when we are preparing the advanced healthcare directive?
Well, certainly in Ontario and in fact all of North America, organ donation is such a positive thing to be able to provide life and support for someone else at the time of tragedy for one person. Because an advanced directive is not legally binding in Ontario, having a mention of that is not legally binding. But having the discussion and talking about your wishes in such a document can help your loved ones be more comfortable at the time that perhaps you do succumb to your death. And this will help to direct the healthcare team as to what might be appropriate and what you might have already agreed to.
Now, if somebody's advanced healthcare directive says that do not admit me to the hospital, now and the patient needs hospital admission without which he cannot be saved, what do you do in that case?
Well, I think there's kind of two scenarios. One is that if the patient is able to confirm their wishes themselves, again, providing treatment to someone against their will is, except in certain very specific situations with children or under the Mental Health Act in Ontario, if someone is capable, as we've talked about, then a healthcare provider must respect their wishes. The substitute decision maker has the power, according to the law in Ontario, to make decisions. And so if this instruction not to be admitted to hospital, not to have some treatment or not to have aggressive interventions is their wish, then we must follow those wishes. I think sometimes where we get into challenges is that we may not want to have those treatments, but we need more support. And so it's important to have discussions, particularly as these types of discussions are complicated around not resuscitating, with the healthcare providers, with your family doctor, with your nurse practitioner, with the people who are involved in your care, as well as your family.
Now, as a healthcare provider, I'm asking this question to you. If I do something for a patient to save him, and I don't know what are the advanced healthcare directive, and I do something against his wish or her wish, what happens to me in that case?
Well, again, in Ontario, I think the law really permits us, if we believe that we're acting in the patient's best interest, as we always should be, then the law protects us. You know, I think that none of us would do something that we didn't believe was good for our patients. And of course, the people who do that
But
are,
even if that is against the wish of the patient.
well, and so of course, if we don't know what those wishes are, we really need to be thinking, and all of us, it's our responsibility as healthcare providers to make sure that we're asking ourselves the question, is this treatment what's in the best interest of my patient right now?
Right. Now, finally, what will be the take-home message for all our viewers today? Would you like to say some message for them?
Well, I would really encourage all our listeners to think about these discussions, to have these discussions with the people you love. As much as it might be a difficult thing, set a time, sit down together, tell your loved ones how important it is that they know what you want and what's important to you. Use the information available online from the CHPCA, from the Speak Up campaign, the Ontario Workbook. Have these discussions and let your loved ones know. Make sure that the people who might be in the position to make a decision for you know what you want.
Thank you, Dr. Miller. That was really helpful for all of us.
Thank you.
Thank you. Thank you for watching the show.